Hi, everyone. My name is Alyssa Vanderziel, and I'm a PhD candidate in the Department of Epidemiology and Biostatistics. And I'm also a graduate research assistant here in the Department of Family Medicine. And I am studying the health effects of prenatal cannabis use in 2 Michigan cohorts. Okay, so the work that I am doing is in collaboration with my primary advisor, Dr. Omaima Alshwari, in the Department of Family Medicine. And this work is for my dissertation. So again, we're investigating the health effects of prenatal cannabis use in 2 Michigan cohorts called MARCH and CLM, and I will get into both of those cohorts further along in the presentation. First, a little bit of epidemiological background about cannabis use in pregnancy. Cannabis use prevalence has more than doubled among US pregnant women in the United States over the past few years, which coincides with the legalization of recreational cannabis use by US adults. Existing studies on the association between cannabis use and birth outcomes are scant and collectively inconclusive. So while some research suggests the harmful effects of prenatal cannabis use, others report null associations. Additionally, some pregnant women claim that cannabis alleviates symptoms of morning sickness, and they perceived cannabis to be relatively safe during pregnancy. However, the majority of these studies are qualitative. And lastly, epidemiological research is limited by retrospective data collection and the use of administrative records, which introduce recall bias and issues involving incomplete data. So the first cohort that I'm going to be talking about is the Michigan Archive on Research of Child Health, or MARCH. MARCH is a prospective cohort study recruiting pregnant women starting in 2017 from 11 sites across Michigan, making the sample very generalizable to the state of Michigan. Participants were pregnant women 18 years and older. MARCH used a probability-based sampling approach to reflect Michigan's population, and the study plans on recruiting 1,000 participants. So 2 aims. The first is to estimate the association between prenatal cannabis use and birth outcomes, which include birth size, preterm birth, 5-minute Apgar score, and NICU admission following birth. Additionally, we are interested in investigating the degree to which morning sickness might be associated with using cannabis during pregnancy. And we'll measure the degree of morning sickness using the Pregnancy Unique Quantification of Emesis scale, also known as the puke scale. You can see it below, and essentially it's a series of 3 questions about morning sickness symptoms in the past 24 hours, such as feeling nauseated, vomiting, and dry retching or dry heaving. And essentially, this is a standardized scale, and the composite score is categorized into mild, moderate, or severe morning sickness. The second cohort is called Cannabis Legalization in Michigan, Maternal and Infant Health. And this is a study that Dr. Alshwari and I recently launched in 2 Sparrow clinics beginning in October. Those clinics are Women's Health and Family Medicine. We've collaborated with Dr. Roscoe's here in Family Medicine and also Dr. Maslevich from Women's Health. And this is a prospective feasibility study in which we are recruiting pregnant women 21 to 35 years old who are at their first prenatal care visit. And we have been working with nurses and residents at both clinics. We educated them on the CLM study, so they play a major and crucial role in the recruitment of our participants via word of mouth during their patient interaction during their first prenatal care visit appointment. And they will also distribute a CLM flyer. If the patient is interested, the CLM study staff, which is me, will recruit that participant. The participant will take a self-administered survey, and if they're eligible for longitudinal follow-up, we will also take a urine sample. And I wanted to point out something important. The survey includes a multitude of questions, including questions about general health, past pregnancies, of course, current pregnancy, morning sickness, and cannabis use, of course. So what's different about CLM compared to March is that our survey is very much so focused on the cannabis use aspect. So we ask questions ranging from lifetime cannabis use to recent cannabis use, frequency of use, how the participant uses cannabis, for example, smoking, vaping, eating. And we also ask questions about risk perception, and the risk perception is in terms of the mother's risk to her own health and risk of to the child. As I said, this is a longitudinal study, so we do follow up our participants, and to be eligible, women have to be in their first trimester, and this allows us to study cannabis use throughout pregnancy during trimester 1, 2, and 3. And of course, we administer a survey within 1 month postpartum to get data on birth outcomes as well. And we only recruit women who do not use other drugs, and this controls for polysubstance use. And the aims of this study. So this is a feasibility study where we are assessing recruitment and retention of pregnant women who regularly use cannabis. And we're measuring this by willingness to participate, willingness to complete the baseline survey, to provide urine samples. We're interested in the percentage of pregnant women who are only cannabis users and who are retained during the follow-up assessments. And that is it. For more information, or if you have any questions, please feel free to email me, Alyssa, or Dr. Alshwari. Thank you.